Hi, Chris George from Next Step Insurance, and I also have a small company that I started just called ACA Academy to talk about the ACA and why you can't ignore it. This presentation is specifically for Physicians Mutual Medicare supplement agents. It's something that has been sitting, I've been wanting to talk about this for a long time about why you cannot ignore the ACA. So I'm going to just jump right into it pretty quickly. I want to I want to show you why you've been missing out. I personally absolutely love the marketplace. I know when it first came out, it was like, what's going on? And can you make a living off of this? And the answer is yes. You can make a living. You can actually make a pretty good living. I've been doing it, started a business, and have grown so much that I had to get a partner to help me with the Medicare side. And we have found that the ACA is just this natural funnel into Medicare. You take care of them before they turn 65. You are going to have them as they turn 65 and become Medicare eligible. So, all right, here we go. I'm going to show you, and this is why you just can't afford to ignore ACA anymore. It's here to stay. I know when it first came out, we weren't sure if it was going to stay, but it is. And it is pretty exciting because now it's becoming more fleshed out. But some of you may not know who I am, so I just want to show you who I am. So I am Christina George. I'm an insurance broker. I have been working in the marketplace in the ACA space since 2013. So right when the Affordable Care Act went live, I was there. I was using healthcare.gov to enroll people and was very, very aware of some of the glitches. So I've seen it from the beginning. I currently have over 600 individual ACA clients at any time, but for a very long time, I had 900. So it's really hard to sustain 900 by yourself or to move past 900, especially if you have open enrollment with Medicare at the same time. But I own a business and I have 17 staff members, um, and I still maintain about 600 individual clients. So I did end up building an agency with 6 agents and then support staff. And I personally love the Affordable Care Act. I really do. And I have done thousands of applications. Heck, I've done one person, I had to do her application 30 times to get it to work right. So I have done this system inside out, backwards and forwards, and I know it really, really well. And my agency has been voted the #1 insurance agency 3 years in a row now. And last year was the first time they had vote for your favorite agent, and I won, and I was very honored by that. So when I say I know what I'm talking about, I really do. So I do this to brag, not because I'm so awesome, but because I want you to understand that I know what I'm talking about. So I'm going to give you a really brief history lesson of what the ACA is. So then, when it was created, so originally the Affordable Care Act was created in 2010. So that was the initial Congress signed the law. President Obama signed it, and it went into effect with a start date of 2014. So the purpose, whether they were successful or not, can be a whole nother discussion. But the purpose was to increase protections for people who couldn't get employer coverage or for those who couldn't get it because of illness. So they wanted to emphasize wellness and prevention and improve quality. Now, again, we could talk about whether those things were successful or not, but that was the intention. And they thought they were going to help curb the rising cost of healthcare. That one, I don't think they've actually been very successful at. But the law, it had 3 primary goals. So the first one, to make insurance affordable for most people. So what was that mean? What did most people mean? Well, at the time, they said anybody between 100 and 400% above the federal poverty level would get a tax credit. And they would add as much tax credit as needed to make the second cheapest silver plan roughly 10% of income. So for every $100, $10 should go to your healthcare. That was the calculation. And I don't think that's an unfair calculation. So they would add however much tax credit to make it affordable for anyone between 100 and 400% of the federal poverty level. Then they offered to have it expanded to Medicaid programs to all states. So the feds wanted every state to be kind of on the same level, same playing field, so that Medicare or Medicaid was available to everybody above 138%. The states were then, some things did change, and they were given the option to opt out of a Medicaid expansion state. Now, our state of Wisconsin is not really a Medicaid expansion state, but we've always had an amazing Medicaid program. So we're kind of this weird hybrid. But there are states like Texas that have pretty much a horrible Medicaid program. In South Dakota doesn't have income tax. So they only cover a pregnant woman like the last trimester in the first 6 months of a baby's life. And that's kind of it. Yet in our state of Wisconsin and Minnesota and a couple other states, it doesn't matter who you are, male, female, young, old. If your income is below a certain level, you get it. Well, there were quite a few states that did join the Medicaid program. So in their situation, anybody below 138% gets to go on their state's Medicaid program. And the other reason the law was to support innovative medical care delivery devices with the design to have lower costs overall. I'm still not sure if they meant to reduce the cost for, coming from the doctor, or just reduce the cost of how much a person was going to have to pay. But that was the goal. Now there have been some changes. We are at 10 years since it was going live and we had our first enrollment. So a few things have changed. So now the law provides premium tax credit for anybody, not just 400 and below. They actually expanded it so that if the second cheapest silver plan is considered not affordable, which now instead of 10% is 8.5% of your income, you get a tax credit. So you just automatically get that tax credit. So if you make $100,000 for a family of two in their 60s, they now get a tax credit when previously they would not have, because they were above that 400 percentile. If your income is at or below 150% of the federal poverty level, you get a special enrollment throughout the year. And then the expanded Medicaid states have gone pretty much 40 states have them, and 11 do not, including Wisconsin, Texas, Florida. Some of the Medicaid expanded states, like Florida, one of the reasons they have not is because the majority of Medicaid coverage goes to nursing homes. And they were afraid if they expand that, it's going to affect it. And Florida does have a lot of nursing home issues because of that. And then they're still going to design to make the lower the cost of healthcare in general. So why do we need this? It was estimated that 20% of the population under 65 were without insurance at all. And it's still estimated that there's 13% that are without coverage. So if you think, oh, everybody already has insurance or they know about this, they don't. In addition, nearly 40% of the healthcare costs incurred by the uninsured are passed on to those who have insurance. So you would see that cost in either higher premiums, higher taxes, and they average that it's actually those uninsured people are costing on average about $1,000 a year for families that have health coverage. So you're still paying for those people that don't have health insurance. If they can get it and we show them it's affordable, then it's going to be much better for everybody overall, and actually we will spend less. They also noticed that there was some health disparities between some of the lower income. There's certainly in minority sections. So this has decreased a bit. There's a little bit more people that are on that didn't have it before, but there's still lower income pockets of minorities that don't even know that the Affordable Care Act is really around and there. So they decided to make this about the system and focusing on prevention. We see that in dental. So dental insurance was one of the first ones to really go, dental clinics, not just insurance, dental clinics. Hey, if we make people come for their cleanings twice a year, we will reduce how much cavities they have, how much needs for root canals and crowns. And that's exactly what has happened. We now have very few children that are going to need all the work that our baby boomers need and Gen X. I remember I never went to the dentist until it was like, oh, my teeth kind of hurt. Or your mom's like, oh, you must need your teeth cleaned. Your teeth are getting bad. It was not regularly, it wasn't yearly by any means, and it certainly wasn't biannually. But once they started implementing that in the late 80s and 90s, where it's now standard, we all get our teeth cleaned twice a year, they have seen a severe reduction or significant reduction in medical problems with teeth. Well, that was the same thing for the Affordable Care Act. They just went, if we can encourage preventative things, we will reduce over time those expensive things like heart attacks and stroke and cancer and diabetes because it'll be caught early. And Physicians Mutual is great about that. That's one of the things that Physicians is known for, is supporting preventative, right? We help pay for preventative if Medicare doesn't do it. We also help with the cost of other preventative services. So this should be right up your alley, something you're already talking about. And by the way, all of these things have improved since 2014. So I know we still have a long ways to go and it's not perfect. The Affordable Care is not perfect. Medicare is not perfect and it's been around a whole lot longer, but it's come a long ways and it's still working. So one of the things that I noticed, if you sell Medicare and you switch to ACA, you have to twist your thinking. You have to remember ACA is not insurance. So Medicare is, right? Medicare is a big government insurance policy, and we're selling supplements to supplement that insurance policy. But the ACA is not insurance. It's just a law. So it was the Patient Protection and Healthcare Law of 2010, amended by the Healthcare and Education Reconciliation Act. And now we just call it the Affordable Care Act, or ACA. The Affordable Care Act went live in 2014. It started in the fall of 2013. It was guaranteed coverage and affordable premium. So it depended on where you fell in that poverty level, but it was affordable. Pre-existing conditions must be covered. There's no rate ups or riders allowed by the carriers. So they can't have like a really high deductible and then offer a hospital indemnity plan or an accident policy. And then no max benefit, unlimited lifetime max benefit, and then free preventative, and then covering the essential health benefits. So that's pretty much the gist of the Affordable Care Act. There's some more to it, but those are the main things. So it's not a law. It's just, or it's not insurance. It's the law of what insurance carriers have to do. The rest is kind of up to the insurance carriers. So just remember, it's insurance, not a law. Those 10 essential health benefits, here they are: outpatient services, prescription drugs, emergency services, rehabilitative and habilitative services, labs, hospitalization, babies, newborns, preventative wellness, chronic disease management, pediatric services, mental health and substance disorder services, and behavioral health treatment. Of these 10, the state of Wisconsin covered 8. So the state of Wisconsin didn't really have much changes when we did this. This was already required by our state. Now, there were states who didn't do this. I had a lady come to my office who came, I believe, from Georgia. She was on group health insurance and was told, in order to have your pregnancy and birth covered, you have to tell us 1 year in advance and you have to pay a monthly premium higher for that entire year before you get pregnant. And if you get pregnant in that year before it's done, we will not cover it. And we think about that now, and we're just like, what? That's crazy. But that actually was pretty standard in many states. So these 10 categories now are across the board. This is what is included. These are the 10 essential health benefits that every Affordable Care Act insurance has to cover. Other than that, it's kind of up to them or the state. So like bariatric surgery. Don't ask, does the Affordable Care Act cover bariatric surgery? Well, it's not one of the 10 essentials, so it's up to the carrier. Some states require insurances to cover bariatric services. Other states don't. Some insurance company goes, well, if your doctor really recommends it, we will. And other carriers are like, nope. So it's not insurance. This is the only thing the ACA requires them to cover. Everything else is kind of up to them. So who can buy this? Well, technically everybody can, but only certain people can get the tax credits, which is what we want to get to make it affordable. So it's ages 0 to 64. I do have some clients who are only babies because their parents have military coverage, but the military doesn't cover babies. Adult children that are getting off their parents' plan at 26, employer-sponsored health coverage is just not offered, or maybe it's really unaffordable. Individuals between employment, loss of coverage, and then here's the ones that I think many Physicians Mutual and Medicare agents have left at the door. Early retirees, age 55 to 64. That is probably 70% of my clientele. the early retirees that are so excited to find affordable health coverage so they can quit their job. And maybe one spouse is on Medicare. Maybe the spouse who had the insurance is ready to retire because they're 65 and the other spouse works part-time. This is where you can get them. You get a 2-for-1. And you also can help those who are over 65 but not eligible for the free Medicare Part A. So if they don't qualify for the free Medicare Part A because they didn't earn enough credits, usually that's immigrants that came in later in life, they can actually go on the marketplace and get tax credits. So these are who can get it. Now here's a list of who cannot get it. So this is where you have to think of some alternative things. And if you want to know more of that, we can discuss that at a later date. But this is just so you know who who can't go on the marketplace. If the employer is offering them health insurance that's both comprehensive and affordable, and affordable means that the cost for the employee and family is less than 9.12% of household income. So that's what they said. If it costs less than that, it's affordable. If it costs more than that, it's not. Somebody eligible for Medicare. So if somebody's disabled, they can't go on the marketplace and get tax credit if they are Medicare eligible, VA coverage and Medicaid. Then people not here legally in the United States, currently incarcerated, and prospects earning too much money. So if somebody makes $1 million, well, the second cheapest silver plan is already less than 8.5% of their household income. So they're just not getting a tax credit. They can still get the insurance, it's just not going to give them a tax credit. And then a unique one that is not eligible is DACA recipients. That is soon to change if the ruling and everything goes through, but currently DACA recipients cannot get it. But if they change that, there'll be about 14,000 people that can get it now. And then those who are getting ICRA and QSERA. So that's really more in the group world. Again, if you want to learn more of that, I have something else for you, but this is just kind of to let you know who can't get tax credits. So what are the marketplace tax credits? This is always confused. People think it's a subsidy, and I guess you could call it that, but it's a tax credit. And I know as a self-employed person, I'm trying to find every tax credit I can. That's what this is. It's just a tax credit. There's no shame in this. There's no reason not to take this. If you are a family of 5 kids, you're going to take all 5 kids tax credits. You're not going to just take 2. So it's a tax credit, but it's based on income, household income. It's not based on the income of the person who's just getting it. So now you have to turn off your health insurance hat and you have to think IRS, because really it's the IRS who's determining who gets the tax credit. It's really not about health insurance now. Now it's about household income. So what they need is the MAGI, the household's MAGI. And if you're like me, you're like, what the heck is the MAGI? It's not found on your tax forms. So you can't pull out your recently done tax forms and find a line that says MAGI. And MAGI, I don't know if you know what that stands for. I'm a pastor's kid, so I don't know. It just makes me think of the Magi coming from the east, following the star. But that's not what it is. What it stands for is the modified adjusted gross income. Both spouses in the household, regardless of who has coverage, and dependents who make more than 12,000. So you have to be careful when it's a dependent. If they're making more than 12,000, you have to go, are they really a tax dependent? Maybe it's a weird summer class while they're in college and they just happen to make good money. But even then, maybe they should be on their own plan. But if they make more than 12,000, you also have to include that. So it's household income. The part that makes it unique is the modified part. So first of all, you have to figure out the adjusted gross part. So that's all your wages, tips, salaries, taxable interest, all of the things you get to tell the IRS is income. And then you are allowed to subtract certain things, self-employed expenses, student loan interest rates, just the interest though, IRA deductions, moving expenses, and some very, very small amounts of deductions. That gets you to your adjusted gross income. But the modified is that line right there that says other income. So what is other income? Other income is non-taxable foreign income, non-taxable Social Security benefits, and tax-exempt interest. Now, I'm not sure how the IRS is told about untaxed foreign income or tax-exempt interest. I mean, it's kind of like, hey, I made money, but you don't need to know about it, but I still tell you. I'm not sure how that works. But Social Security is sometimes not taxed. I've been doing this a lot, and I've seen people who, if they're only living off Social Security, it's probably not taxed at all. I've seen it where it's partially taxed, and then I've seen it all taxed. So the government is saying you have to include 100% of your Social Security payment, regardless if it's taxable or not. So if you're talking to somebody who's not collecting Social Security, then you don't have to worry about the modified adjusted gross. It's just their adjusted gross. So 99% of the time, it's just really you have to worry about the people who are collecting Social Security. They may tell you how much shows in their bank account. Well, are you having taxes taken out? I need the gross amount. So that's the other income. Other than that, it's actually pretty simple. So use gross Social Security amount, even if it's not taxed. So eligibility for tax credit, though, is still based on IRS household income. So in the past, you have to ignore everything you've made in the past. So it's based on this year's, what you think you're going to make in 2023 or 24. So you have to think ahead in the future. You could have made $1 million last year, you retired, and you're living off Social Security. That's all they care about. What are you going to make the year that you need coverage? Everyone in the household. There's no income brackets. There's no like from this dollar to this dollar, this is what it is, and this dollar to this dollar. It isn't. It's a percentage. If you make more money, they're going to take less. You're going to get less tax credit. The calculation's based on the second cheapest silver plan in the county for the individual or family. And if the rate of the plan is more, if that second cheapest silver plan is going to cost the family more than 8.5% of their modified adjusted income, ta-da, tax credit. That's it. And so if they don't get a tax credit, that means that second cheapest plan is already less than 8.5%. So it's actually a fairly fair system. So now that's the history. That's kind of how it works. Now I want to tell you reasons why you should be selling it, why you should not ignore it. So one, you can earn commissions per member per month. So it's accumulative. It just gets bigger and bigger and bigger the more clients you get. Two, more Americans are eligible for coverage than ever before. There is a Medicaid rollback. In Wisconsin alone, 1.3 million people are going to get kicked off Badger Care. And that's just our state. They're estimating around somewhere between 14 to 30 million people across the country are going to lose their Medicaid system. Some are going to go on group insurance, which is great. Some are going to go to Medicare, and a good chunk of them are going to need to go on the marketplace. So if you're thinking about selling it, this is the year to do it. Reason number three, your Medicare client spouse isn't eligible for Medicare yet. Take care of both of them. You get the husband and the wife. And sometimes you get their children if they've got an older child or a younger children who's coming off a plan. You're going to sell from carriers that you already know, and they are good companies. Number five, ACA certification is so easy. It's so much easier than Medicare. So the first time you certify, it probably takes about an hour at ffm.gov. That's it. And then you're done. And then next year, they kind of just go, do you remember what I told you before? You're good. I think I did it in 20 minutes. And that's it. It's a one and done each year. You don't have to do those AHIB certifications. You don't have to do all of that stuff. It's so much easier and very fast. Your ACA clients could become your Medicare clients. That's a huge reason right there. You could just advertise for ACA and never advertise for Medicare and just keep those people as they turn in. You can extend your busy sales season and make record sales throughout the year. So Medicare, you're kind of trying to find the person who's turning 65. With this one, ACA is happening all the time. People are retiring. They want to retire. They want to come see you. And with the Medicaid rollback, there's thousands of people looking for somebody to help them find insurance right now. And reason number 8, being a well-rounded agent is the key to successful insurance sales. You can layer so many great things that we sell both in Physicians Mutual, the cancer, the life insurance to the marketplace people as well as your Medicare clients. Now, I'm going to show you how quick it is to quote. I know Medicare has a lot of regulations and there's a lot of requirements, and it takes some time and you have to explain them. What is Part A? What is Part B? What is Medicare? What's a Part D? What's a Part C? You're going to have to go into a lot of detail, and it can take a long time. I'm going to show you how fast it is to quote with the insurance. It's It's so fast. Like it's kind of shockingly fast. Right. Here is a quote. I'm going to do Sheboygan County, 62, single person, or mixed to a 4,000. They're going to be the top like this, and within scroll up, using compare them, best one, don't need to extend this. So that's how fast. Now, when you first start, it's maybe a little slower because you get to learn the plans. But once you know the plans and the carriers, it's really easy. In fact, I do a class every year for my clients, showing them where to do, what to look at. I'll be happy to send you to that class. You don't even have to do all the work if you want. I can send you my class to my clients to help them find their own. It's so quick. It's less than 5 minutes. It's really a very easy thing. They see that 292, ha, they're like, sign me up. I'm done. That's it. I can retire. It's very affordable. So ignoring the ACA is losing money. You are literally walking away from money. Think if you have been doing this, if you've been selling Medicare since 2014 and you have turned every ACA person away, how much money have you left on the table? You've left thousands of dollars. But then you've heard, right? You've heard, commissions, they suck. Everybody knows the marketplace, those commissions they're not worth it. So how much is it, right? So I'm going to show you, here's true numbers for the average in the state of Wisconsin. So average commissions are $17 per member per month. Some carriers are a little more, some carriers are a little less, but that's the average. So remember, I said I had 600 individuals. That's an annual income of 122,000. And I don't have to do anything new. I didn't sell any ancillaries. That's just on the marketplace. Now, I don't expect you to have 600 clients if you're doing a Medicare. So is it worth it if you only have 100? Well, there you go. 100 clients is an extra $20,000 that you've been walking away from for years. And just like Physicians Mutual, where we talk about stacking, protecting your clients, you're going to do the same thing. You're going to do that with ACA. So you're going to add dental. You're going to add a cancer policy, add life insurance. So this is what you can look at. So one person on the ACA, $204. You add one dental, here's your commission. You add one cancer, here's your commission. You add one life, here's your commission. How much did you make for one person? One client just earned you $929. And if you were great and you did this stack of cancer, life, and dental on 100 ACA clients, it's almost 6 figures. Now, I do know the rates go down. Those commissions on the ancillaries aren't as good the first year. That same group of people, now you're making 38,000, almost 40,000. That's nothing to sneeze at. That's good money. And you have the pipeline already there. So you're just going to funnel your Medicare business. You're going to get some people that are both ACA and Medicare's prospects, particularly spouses of your Medicare person. So there's your one spouse Medicare, one spouse ACA. When the spouse that's on the marketplace turns 65, they're going to become your Medicare client. You are continually growing your business. And now, no more walking away from money. ACA is simple, but it's also complicated. It's partly why I like it so much. So I did create a class. You can certainly do this on your own. I can give you some FMOs. I actually am an upline as well for ACA clients to help you start selling ACA client products, ACA products. But if you really want to know and you want to know how to do this, I did create a training program. This is actually a nationwide training program for agents all over the country because I'm realizing how many FMOs, how many people don't really know how to do this. And I've been doing this since the beginning, so I'm going to show you and really how Medicare agents have to think separately. You know, don't forget everything you learned about Medicare. So that's why I created this. The goal to help you become the local expert. It's a class that you can go at your pace. They're recorded. There are some live classes, but most of them are just online. There's 8 recorded classes and 2 live classes. And again, you get to kind of pick it. So here's the course topics, right from what is the basics all the way to some really complicated stuff. And then it's a very comprehensive program. And if you want to learn more, I'm happy to teach you. You can email me at aca-academy@outlook.com. I did create a 50% off coupon for everybody who's Physicians Mutual to use to buy that course, 50% off right away. That's the website. If you have any questions, you certainly can email me at the ACA-academy@outlook.com. I'm happy to talk to you. If you actually want to schedule a chat with me, shoot me an email. I'll shoot you my calendar and we can talk about this. I am happy to help anybody learn this because I believe in it, and you can protect your clients if you understand it really well. So I want to thank you for giving me this time, for stopping your day to listen to me. And I appreciate it. And I love Physicians Mutual. That's why I've been wanting to teach this class. I have had their dental forever. I did sell Physicians Mutual for the Medicare, but my ACA book of business just took off and took over. And I just loved it so much, I stuck with it. But I love teaching people how to do this. So if you want to learn more, please reach out. And thank you, Physicians Mutual, for letting me teach this class and sending it on to people who want to learn more. Thank you.